Hi, my name is Alina and my partner's name is Adriana, and this is our KINE 4305 partner case study. Okay, so our case study is done on Chuck, and on this side, I'll talk about his personal information, exercise history, and medical history. So, to start off, who is Chuck? Well, Chuck is a male, black, and his age is 31 years old. He weighs about 155 pounds and he's 6 feet tall. Chuck's exercise history has been that he has been a competitive middle distance runner since the age of 15. So he's been running for about 15 years and he runs about 10 to 15 miles a day. So, what is Chuck's medical history? Well, in the past 3 years, he had a recurring history of having stress fractures on both tibias, and he recently got diagnosed with an anterior compartment syndrome on both shins.
So, our client didn't specifically mention any personal goals that he wanted to achieve through this exercise prescription. So, the purpose of our prescription for Chuck will be to help him maintain his functional lifestyle.
Okay, so let's go over why Chuck is considered, based off the ACSM risk factor guidelines, a low risk for cardiovascular disease. So, first, the only risk that Chuck has is that he had a first degree male relative who passed away before the age of 65 due to a myocardial infarction, and that relative of his was his older brother. However, Chuck's parents do not have any known cardiovascular disease. Chuck does not report any cardiovascular related problems. Um, Chuck's age is not a risk factor because if Chuck was over 45, then he would be considered a risk. That would be a risk factor, but it's not. Chuck is not a smoker and he's physically active. Therefore, those are not risk factors. His BMI is good because if he was over 30, then that would be a risk factor, but he's not. And then his blood pressure is good too, both the systolic and diastolic levels, so that's not a risk factor. And then for his lipids, his LDL is 88. If it was over 130, that would be considered a risk factor, but for him, it's not. And then his HDLs are 45, and if they were under 40, then that would be considered a risk factor, but it's not. And then his blood glucose is 80, and it would be a risk factor if it was over 140, but it's not. So that is why Chuck is a low risk for cardiovascular disease. So, an exercise test that was done prior to participation of this exercise program was that Chuck did do a graded exercise test, and his VO2 max and came out to be 60 milliliters of kg per minute. So,
So, when it came to the cardiorespiratory fitness component of Chuck's prescription, the two things we had to take into consideration when prescribing him with these exercises was his diagnosis of anterior compartment syndrome, as well as the history of his stress fractures to both of his tibias. Because of this information, we wanted to ensure that the exercises we were prescribing him were considered low impact exercises. So we did cycling and shallow water running, alternating these two between Monday through Saturday and giving him Sunday as a rest day. We also progressed throughout this prescription using the 10% rule of progression and making sure to not exceed that 10% because we wanted to avoid injury and also worsen the conditions that he was diagnosed with. We also progressed throughout the 4 week prescription from a moderate to vigorous intensity using the Borg 0 through 10 RPE scale.
for our muscular fitness prescription that we did for Chuck, we really wanted to make sure that since he does have that anterior compartment syndrome and those stress fractures, that we really just didn't want to be putting any more stress and pressure onto those shins, and tibias. So we wanted to focus a little bit more on doing upper body and building more upper body strength while he did recover. However, we still did low body workouts. We just focus on doing it more body weight and resistant bands. That way, there's not so much pressure. Um, we decided that we'll be doing 2 days every week. And it was gonna be a full body workout. So it was gonna be a full body workout on Monday and a full body workout on Thursday. And that's just what we decided would be best for him. And really just mostly focusing on that upper body while his lower body did heal.
Now, when it came to the flexibility portion of Chuck's prescription, we made sure to exceed the ACSM guidelines for flexibility of at least 2 to 3 days a week by prescribing 6 days of flexibility workouts from Monday through Saturday, again, giving him Sunday as a rest day. Now, we incorporated yoga and Pilates for his flexibility, not only because they can provide a great source of flexibility, but they can also help to efficiently reduce stress by promoting relaxation and improving mental clarity. Now, in Chuck's case study, he did mention that he was very stressed from his workload. So, in order to manage his stress, he would go for 10 to 15-mile runs daily. Now, because of his medical history, running these long distance is not very good. It doesn't have very good beneficial effects for those diagnoses. So we wanted to make sure that not only he was getting in a good flexibility workout, but he was also provided another way to help manage his stress as well. We also, for a couple of those workouts, incorporated breathing as well, which is another way of managing his stress. We also wanted to place some emphasis on his lower body stretches as well, because through increased flexibility, you're also improving your blood flow, which would release some of the tension from his anterior compartment syndrome diagnosis, specifically in his shins. Um, and then finally, for the intensity, this was self determined by Chuck himself. Um, this was until slight discomfort was felt. So we wanted to make sure that we weren't placing too much stress on him and specifically his lower body because of his past medical history. So, just to wrap up our presentation, looking at our client, Chuck, he was a very physically fit individual and he was relatively healthy as well. Aside from his diagnosis of anterior compartment syndrome and his history of stress fractures to both of his tibias, he was a very physically active and healthy individual. So, for this prescription, the only things that we really had to take into account were those two, was his medical history of that diagnosis and his the history with the stress fractures. We made sure to modify not only our cardiorespiratory fitness, but our muscular and our flexibility components as well to make sure that these were low impact workouts to not only avoid injury, but to not cause extra stress to his lower body as well. Um, like I mentioned, he was very healthy. The only risk factor that we were able to identify for him was the death of his older brother by a massive myocardial infarction, um, which does, like I mentioned, it is a risk factor for him because that's his immediate family. Other than that, he was very low risk, so there was no kind of medical clearance that needed to be done before he um, went through with our exercise prescription. Aside from that, that is our entire presentation. So thank you for listening.